Like many of you, we are following guidelines to stay home as much as possible, and we ask you, please, please, please do the same. We begin with this. The president, he's laid out the administration's plan to begin reopening this country, suggesting less affected states could start doing so by today. So it includes 3 phases to gradually lessen restrictions. In order for a state to reopen, it would have to meet and maintain certain criteria. What does that include? Lessening of the symptoms and cases within a 14-day period. Hospitals would have to be able to treat all patients without being overwhelmed, and they have to test healthcare workers.
After initially claiming total authority, the president now says this decision is in the hands of the governors.
I don't want anyone coming back that isn't in position to come back. The last thing we want is for, let's say, a New York to come back too soon. I think it'll be much faster than people think. I think it'll be quicker, but it's got to be safe.
Meanwhile, this is the first active duty service member to die from the coronavirus. 41-year-old Charles Thacker Jr. of Arkansas was a sailor on board the USS Theodore Roosevelt. He was diagnosed March 30th and died 2 weeks later. 655 sailors on board the aircraft carrier have tested positive.
Still an ongoing crisis there. Every Friday, we are taking time to answer your most pressing questions about the coronavirus. As President Trump looks to reopen the country, many of you have questions about what our new normal might look like. So we brought in our senior medical correspondent, that's Dr. Tara Narula. She's here with some answers. Dr. Narula, good morning. So the president's guidelines are non-binding, and he left it up to governors. So there's going to be some variability here. But generally speaking, what might the new normal look like when we begin this phased reopening?
Well, it's definitely going to be new, Tony, and it's going to mean distancing, but a little bit of freedom. So the first important thing that they recommended is that vulnerable populations continue to shelter in place. For the rest of us who may venture out, it's important to maintain that maximal distance between others and avoid social gatherings of more than 10 people. When you look at other social gathering type events, whether it's at a movie theater or at a restaurant, those types of events are going to be allowed as long as you're able to maintain maximum social distance. That's the same for gyms. Interestingly, bars are not going to be allowed to open in this phase 1. Schools that have been closed should remain closed. When we're talking about the workforce, workers can begin to slowly go back in phases. So maybe 20% of the workforce, then 40%, then 80%. And also they're encouraging telework for that phase 1 process as well. Limited to no visits to nursing facilities and hospitals, so those are really going to continue to be prohibited. And then minimizing non-essential travel.
So we aren't really sure, because of under-testing, how many Americans have this illness. Also out of South Korea, there are reports that people who have had it may be able to get it a second time. So with those two facts in mind, how worried should we be about a resurgence of the disease?
Well, I think we have to be careful, and you've heard us talk a lot about the need for testing so that we don't encounter a situation where we open up and then once again we're seeing lots of cases. When you're talking about these cases of, quote, reinfection that the Korean CDC has reported, most of the experts that we've talked to have said that it is unlikely that these are true reinfections. It would be very unlikely to get infected and within 4, 8, or 12 weeks get reinfected. So those were probably false negative tests, negative because of either the way the test was collected or processed. This is different, however, from a situation when you're looking out 6 months or a year. In those cases, if you did not develop full immunity, you may be able to get reinfected. And this is what time is going to tell us. There may be some individuals who don't mount a very strong antibody response. So we'll have to see.
Tara, Allen on Facebook asks, if you've fully recovered from the virus, should you still wear a face mask?
Yes, Alan, and everyone else who's wondering, you should. The CDC recommends that even if you've recovered, when you venture out, you should continue to wear those face masks. Also important in terms of coming out of your own isolation, if you yourself were sick, you want to follow those guidelines of fever-free for 72 hours, lessening of your symptoms, and either 2 negative tests 24 hours apart, or the 7 days since the first onset of symptoms.
Tara, I've noticed when I take walks in a park, a lot of runners and bikers are not wearing masks. Our viewer Leslie asks, should they be wearing masks?
I noticed this too on my run yesterday, Anthony. So this is something that we all should be aware of. If you are living somewhere that is remote or desolate and you're on a trail where no one else is around, it's probably fine to run or bike or walk without a mask. If, however, you're somewhere like we are in New York City where you're going to encounter other runners, bikers, or walkers, you do want to go ahead and wear a mask. One of the recommendations is something called a buff, which runners know about. It's moisture wicking, quick drying, and it's kind of a fabric neck gaiter that you can put over your mouth. You want to try to run or bike at off-peak times, and you may want to increase the distance from 6 feet to maybe 10 or 12 feet from other people. Just because of wind and the heavy breathing that you may be doing, it's possible that those droplets could travel farther.
Tara, I've got two questions, one from Barb and Shannon, but we get this a lot. Barb says, should we wipe down groceries before putting them away? And Shannon from North Carolina in the same vein says, should we wear gloves when we receive mail or packages?
Yeah, so similar concept. The thinking is that it's very unlikely that this is a real high source of transmission. Theoretically, you could potentially touch something that someone else has sneezed or coughed on, and then those droplets, you would contact them on your hands, you would touch your face, eyes, or nose, and can get infected that way. There was a study that was reported last month that said that the virus is able to live on cardboard for about 24 hours, plastic and stainless steel for 2 to 3 days. That doesn't necessarily mean that it's infectious at that point. So if you really do want to take precaution, when you bring your groceries in, we can wipe them down, change the packaging, wash your hands, and disinfect the area. But gloves, not really necessary.
All right, Dr. Tara Narula. I actually, in my household, we've been washing our groceries, and I'm very happy to hear that maybe on this Saturday when we go out for that shop, we do not have to wash every single one of them and ruin all the produce. That is good news in this household. Dr. Narula, thank you very much.